typically speaking, when a patient comes in with sciatica, one of the main telltale signs is what we call referred pain. Referred pain normally starts from the lower back, and it can go through the back of the glutes, down the back of the hamstrings, and then into the back of the calf, and even as far down as the foot. It's quite common. Not all cases have referring symptoms for sciatica, but the main black and white symptoms are referred pain coming down the back of the glutes, into the back of the leg, into the foot. The patients may also experience pins and needles, numbness, or even weakness in some worst case scenarios. And that's normally because of compression of the sciatic nerve at the lower back, in which we call a radiculopathy. Now, there's an inner jelly within the discs, and the outer wall of the discs is called the annular fibrosis. It's like a really thick, not plastically, but it's really strong, and they don't normally hemorrhage, as we call it. So typically what can happen is that this disc itself can bulge, which is quite commonly when patients go, oh, I've got a slipped disc, or I've got a bulged disc. And it's just normally when the disc itself kind of gets squozen out, and it kind of takes a little bit of a weirder shape, and it can compress on one of the nerves that exit the spinal cord. And then that compression is on top of the sciatic nerve. And then that's where people can start to experience the pain when moving, particularly from a seated to a standing position, and also pain on movement. If the compression is quite particular on top of the nerve root, some people may experience weakness as they gradually start to walk, or if they may start to stand up or do a task, and then they can feel their symptoms getting worse, and then they typically start to sit down. However, in most cases, mobility is key to getting better. They have to keep on moving, because the whole point of the discs in the spine is that their job is to compress. That's what they're meant to do. They're built once, they're built strong, and they're built to last. So it's kind of counterintuitive as well sometimes when patients experience sciatica, because they genuinely believe that they may cause more damage. And this typically isn't the case, but I can completely understand why they would choose to kind of be a bit more hesitant. And as they start to feel these symptoms coming back down the back of the leg, and then they start to go immobile, because they think, well, this is the only position really that can make it feel better. Absolutely, that's a great question, because there's one condition that, as therapists in the chiropractic world, physiotherapy world, even with doctors, anyone to do with healthcare, especially with musculoskeletal pain, is something called cauda equina syndrome. What a lot of people don't understand is that our spinal cord is completely encapsulated from the top of the brainstem all the way down to the lower back. However, it kind of goes into a horsehair shape, and it doesn't have that protective casing as much, and that's really down the tip of the lower back, and that itself is called the cauda equina. In the very, very worst case scenarios, a disc can aggravate the cauda equina, which is important because all of these nerves at the lower back, they're in control of your urinary tract, they're in control of your bladder, and they're in control of the sensations that you feel from your hips downwards as well. So with cauda equina symptoms, we typically ask it within the clinic if they've got any sort of numbness where they wipe, any pain when they're going to the toilet, if they're passing or urinating. If a person was to experience any what we call the saddle paresthesia, which is the numbness or the loss of sensation in between the legs where they normally wipe after the toilet, that is one of the most telltale signs to go straight to A&E, and then the doctors and the surgeons would do a decompression treatment to decompress the cauda equina. But what I will say, in most cases, this is extreme end. And I personally haven't come across it in clinic, and I hope I never will. I've maybe had one patient where I found that some of the signs were quite close to it, but then these signs like later on decompressed, and they weren't as severe as originally thought. But typically within the clinic, if someone does come in with lower back pain and it's a sciatica presentation, we would typically go through these questions to make absolutely sure that cauda equina is covered. But in most cases, movement is very healthy for this condition. it's the whole point why we train. It takes 4 years of chiropractic and osteopathy to be able to not only treat patients, it's to scan their health. Like, a lot of musculoskeletal issues can be resolved at home with exercise, but in most cases we live such busy lifestyles, it just doesn't work that way. We got kids, got work, you got family, and when these little things like sciatica start to kick in, we kind of seem to think, oh, okay, we have this attitude of, oh, leave it a couple of days, leave it a week, and it will go away. And it's not always the case. And especially with some conditions like cauda equina at the worst end of the scale, you need to be in front of a professional just to make sure that everything is fine. Because if it is fine and it can be treated, then it can be resolved. And in 90% of the cases, it can be resolved. But there's always that little bit of a chance that if you leave it, or if there's a bit of trauma, like a car crash, or you've slipped or fallen over and you start to experience those symptoms that we just spoke about, that's when you need to have a medical opinion or go to A&E. My personal opinion, from my experience of treating quite a few patients this year, it's lifestyle, 110%. There's other factors as well, like age. It's not the biggest of factors, but it all accumulates. And unless it's a traumatic onset, like a car crash, or like maybe not lifting your foot as you're walking over a curb, or bending over too quick to pick something up, these are typical mechanisms that can cause an aggravation to the disc, which can cause sciatica. But in most cases, it's an accumulative issue. It's lifestyle. So, for example, one of the biggest demographics that I see in clinic is desk-based workers. They sit down for long hours. Sometimes they're really busy in work, and they just tend to forget about their posture. And no one's posture is perfect at all. And you've got a significant amount of compression going through the lower lumbars. And then typically what happens then is that we hold this compression in kind of awkward position, in this awkward posture, and for a long period of time. And then these little insignificant accumulations then soon build up then to what I think breaks the straw on the camel's back. It's the body and the lower back is fantastic at adapting. We're one of the most adaptive creatures on this earth. Like, look what we've done through COVID. We've just adapted that quick again. But in regards to sciatica, the body will adapt, and it will adapt, and it will keep on doing so until it can't adapt no more. And then that's when the pain kicks in. That's when the symptoms start to get more aggravated. And then that's when you need to start seeing a professional for the issue.
I started my time at Kube Medical as a patient, and I came in because of sciatic pain. I was a slightly overweight rugby player who had a desk job. So during the week, I'd be sitting with a laptop at a desk with terrible posture, rounded shoulders, and doing all of the bad things there, and then getting on the pitch at the weekend and running around and aggravating things that are built up through the week. So I just had a training session at one stage, and it just shot up through my sort of right buttock into my lower back, and it was pretty classic. And I just, turned up at the clinic and said, help. and I think we see a lot of patients still who are in a very, very similar position.
It's our bread and butter within the clinic. Sciatica is it's so rife throughout the whole of the population of the United Kingdom. We've got a pretty large proportion of our population that's really fit and healthy, and even they struggle with sciatica. It's not because our backs are weak at all. It's nothing to do with that. It's just, as I said, we live such complex lifestyles now, and there's a significant proportion where we don't do enough, and we are a little bit immobile. And I typically see within the clinic that the more active sort of type of people don't tend to have the sciatica because of they're sitting down too much or they're doing too little. It's kind of the opposite at times. But no, it's a significant issue. It's rife, and I don't think it will ever go away completely, because from the 1900s onwards, we were such a heavy labor population. We demanded heavy, hard days of work where we used our bodies a lot. However, with the advance in technology, it's just significantly changed the way that we work. We sit down a lot more. We're sitting down in cars a lot more. Traffic is getting worse as well. So people are tending to sit in the cars for a lot longer after a long day of sitting down in work. And then if you actually accumulated the amount of total hours in a week, if someone was sedentary compared to being active, you would see a huge comparison. And that's where we try to educate our patients within the clinic about healthy movement, is to get them from that point of inactivity to moderate activity. We don't want our patients to jump from one extreme to the other. You know, it's just not beneficial. It doesn't happen like that, and it takes time as well. That's one of the bigger sort of aggravating factors of sciatica, is that it's a disc. Discs are built once, they're built to last, and they don't particularly heal incredibly well like that, as much of a muscle. And that's to do with blood vessels. You know, blood vessels are the lifeline of our bodies. They provide us with oxygen, they take away carbon dioxide, they help fuel all our cells to do their jobs. And if it's rich with blood vessels like muscles, then typically speaking, 1 to 6 weeks, people heal pretty quick. With sciatica, depending on the degree of what's happened to the disc, whether it's a herniated disc, whether it's a slipped disc, whether it's more of a muscle that may be aggravating the movement and the back of the disc. But we can't determine that unless we have the patient in front of us. You have to go through that clinical case history. We've got to ask these specific questions to try and clarify what is going on specifically in that patient's life. Not the typical average patient of, oh, it's another sciatica case. No, you can treat 10 sciatica cases in a single day, and they can have all different reasons as to why it's come up.